Hi, I'm Garvin. Welcome to our telehealth video series. In this video I will give a brief overview of what you need to know about pneumonia. So in particular I'll cover what it is, how you treat it and how you can live with it. So we start with what is pneumonia. Pneumonia is an inflammation of your lungs, usually caused by infection. Bacteria, viruses and fungi or parasites can cause pneumonia. Pneumonia is a particular concern if you're older than 65 or have a chronic illness or impaired immune system. It can also occur in young, healthy people. Pneumonia can range in seriousness from mild to life-threatening. Pneumonia often is a complication of another condition, such as the flu. Antibiotics can treat most common forms of bacterial pneumonias, but antibiotic-resistant strains are a growing problem. The best approach is to try to prevent infection. So the symptoms. Pneumonia symptoms can vary greatly depending on any underlying conditions that you may have and the type of organism causing the infection. Pneumonia often mimics the flu, beginning with a cough and a fever. So you may not realize you have a more serious condition. Common signs and symptoms of pneumonia may include fever, cough, shortness of breath, sweating, shaking, chills, chest pain that fluctuates with breathing, which is pleurisy, headache, muscle pain and fatigue. So people in high-risk groups such as older adults and people with chronic illnesses or weakened immune systems may have fewer or milder symptoms than less vulnerable people do. And instead of having the high fever that often characterizes pneumonia, older adults may even have a lower than normal temperature. So the causes. Your body has ways to protect your lungs from infection. Numerous conditions, including malnutrition and systemic illness, can lower your protection and allow harmful organisms to get past your body's defenses and into your lungs. Once the invading organisms are in your lungs, white blood cells, which is a key part of your immune system, begin to attack them. The accumulating invaders, the white blood cells and immune system proteins, cause the tiny air sacs in your lungs to become inflamed and filled with fluid, leading to the difficult breathing that characterizes many types of pneumonia. Factors associated with the increased risk of pneumonia include age. So again, if you're over 65, particularly if you have other conditions that make you more prone to developing pneumonia, you're at increased risk of pneumonia. And certain diseases. So these include immune deficiency diseases such as HIV and chronic illnesses such as cardiovascular disease, emphysema and other lung diseases and diabetes. Also smoking, alcohol abuse. So alcohol interferes with your normal gag reflex as well as with the action of the white blood cells that fight infection. And hospitalization in an intensive care unit. So pneumonia acquired in the hospital tends to be more serious than other types of pneumonia. Exposure to certain chemicals or pollutants. So this is a risk. Your risk of developing some uncommon types of pneumonia may be increased if you work in agriculture, in construction, or around certain industrial chemicals or animals. Surgery or traumatic injury. So people who've had surgery or who are immobilized from a traumatic injury have a higher risk of pneumonia because surgery or serious illness may make coughing, which helps clear your lungs, more difficult. And lying flat can allow mucus to collect in your lungs, providing a breeding ground for bacteria. So how do you treat it? Treatment of pneumonia involves curing the infection and preventing complications. People who have community-acquired pneumonia usually can be treated at home with medication. Although most symptoms ease in a few days or weeks, the feeling of tiredness can persist for a month or more. Specific treatments depends on the type and severity of your pneumonia, your age and overall health. And the options include antibiotics. These medicines are used to treat bacterial pneumonia. It may take time to identify the type of bacteria causing pneumonia and to choose the best antibiotic to treat it. If your symptoms don't improve, your doctor may recommend a different antibiotic. And cough medicine. This medicine may be used to calm your cough so that you can rest. Because coughing helps loosen and move fluid from your lungs, it's a good idea not to eliminate your cough completely. In addition, you should know that very few studies have looked at whether the over-the-counter cough medicine lessens coughing caused by pneumonia. If you want to try a cough suppressant, use the lowest dose that helps you rest. And few are fever reducers and pain relievers. You may take these as needed as fever or for fever and discomfort. These include drugs like aspirin, ibuprofen and paracetamol. So how do you live with pneumonia on a day-to-day basis or when you're recovering from an infection? So lifestyle and home remedies. So these tips can help you recover more quickly and decrease your risk of complications. Get plenty of rest. Don't go back to school or work until after your temperature returns to normal and you stop coughing up mucus. Even when you start to feel better, be careful not to overdo it because pneumonia can recur. It's better not to jump back into your routine until you're fully recovered. So speak to your doctor about this. And stay hydrated. Drink plenty of fluids, especially water, to help loosen mucus in your lungs. And take your medicine as prescribed. Take the entire course of your medicine your doctor has prescribed for you. If you stop taking medicine too soon, your lungs may continue to harbour bacteria that can multiply and cause your pneumonia again. And finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing pneumonia more effectively on a day-to-day basis. To start with, we have numerous products to get you started on an exercise program, such as exercise balls, floor mats and weights and various other items. We also have various supplements and products which you can purchase from us without a prescription, such as cough bottles and pain relievers and fever reducers, and products to lower, again, fever like paracetamol and Nurofen. We also have light boxes to promote relaxation and blood pressure monitors and blood sugar monitors to monitor your health. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute clinic with us and we help to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing your illness with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas and Cork or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.